Welcome back. It's time now for the France 24 debate. Now, today we're examining the current situation here in France and in neighbouring countries with regards to COVID-19. This is the number of new cases across the continent continues to rise at an alarming rate, prompting governments to implement fresh containment measures. Well, here in France, 9 major cities, including Paris and Marseille, are on maximum alert. And nationwide, the authorities have reported 43,000 new infections during the course of the weekend alone. Well, speaking today, the French Prime Minister Jean Castex warned, and I quote, that there can be no more slacking. And he added that more restrictions are being considered in addition to those already in place, such as the closure of bars and gyms. Let's listen to a clip of what he said.
Donc, aujourd'hui, en tout cas, ce que je veux dire à votre micro, c'est qu'effectivement, nous sommes dans une situation très difficile. Pas que la France, du reste. Il y a la réalité de la deuxième vague est là. Et donc, j'appelle de façon extrêmement claire à ce que nous mobilisions toutes et tous pour faire face à cette deuxième vague. Il ne peut plus y avoir de relâchement. Cette semaine, il y aura, comme toutes les semaines, un conseil de défense. Nous verrons quelles sont, en ce début de semaine, les données épidémiologiques pour voir s'il y a lieu d'aller plus loin. Je vous rappelle quand même que nous venons de classer Montpellier et Toulouse en zone d'alerte maximale. Donc, il faut voir ce que ça donne dans ces collectivités.
Donc, c'est pas exclu. C'est pas exclu des reconfinements locaux.
Monsieur, rien ne doit être exclu. Rien ne doit être exclu quand on voit la situation dans nos hôpitaux.
Okay, the French Prime Minister speaking there, adding that another national lockdown must be avoided at all costs. Well, across the continent, at least 150,000 EU citizens have so far lost their lives to COVID-19. And in addition to this human cost, the EU economy has been plunged into recession. And furthermore, the pandemic has already, for a few months this year, dealt a blow to the cherished cornerstone of EU citizenship, namely the free movement of people. That's something which may happen again in the weeks and months ahead. So the question is this: how do European governments keep their citizens safe without infringing on their liberties? Are new national lockdowns an inevitability, and will the general public play ball in the event of another lockdown? Because there you can see there was anger on the streets of Madrid today, suggests people there not taking kindly to these strict new measures, or indeed to these new kinds of measures. So do we just have to keep calm, carry on, and get better at living with the virus? That's another question I'll be putting to our guest today. Well, here with me in the studio to discuss all this is Edouard Salsas, who is an attorney in international arbitration and a member of the Paris and Madrid bars. Welcome to you. Sitting opposite you is Jean-François Toussaint, Professor of Physiology at the University of Paris, or Université de Paris. Thank you very much for joining us, Professor.
Thank you for the invitation.
I'm also joined by epidemiologist Catherine Hill. Thank you very much for being with us, and welcome back to France 24 to you, Catherine Hill. And from the Spanish capital, we'll be speaking to our Madrid correspondent, Sarah Morris, for the latest on the situation there. Let us begin closer to home, though, than Madrid by looking at the situation here in France. Let's look at the numbers here in France and compare them to France's neighbours. Let's bring those numbers up for you there. So you can see in the rolling average these last 7 days, 14,700 cases per day and an average of 61 deaths. So by no means the highest number of deaths. Spain seems to have a much higher death toll these last 7 days, but the number of cases comparable over a 7-day period to that of the UK, it would appear. Let me turn to you first of all, Professor. What do these numbers suggest to you? Where are we heading?
Well, in fact, what we have seen is that we have a 50 up to 70 death per day rate for more than 3 weeks now, and it has increased from the 2025 number that we had in August. So it means that we went down by 95 to 96% up to August, and then we have a very slow increase that has been seen in the rate of death. It means that the lethality of the disease now and of this phase of the pandemic is very different to what we have seen in March and April. And it means if we are just measuring the slope of incrementation that we had in April and now, we have a 40 lower slope of incrementation. It means that this phase is very different to the tsunami that we have encountered in March and April, and we have to understand what is going on. If the virus didn't change, what did change? Population immunization or something different in the human species, which is the target of the viral species. It's always a question of equilibrium between those two, and it's an armament race that we are seeing. What is going on now is something very different to what we have known in the spring.
Okay, Catherine Hill, let me bring you into the conversation. Is another lockdown an inevitability in your opinion at this stage, or would you agree with what's been said that this is very different from where we were, say, 6-7 months ago?
Well, most of the indicators, the serious indicators, are not the number of cases, because the number of cases depend on how many people are tested and who is tested, and we have absolutely no control on that. So it's more important to look at the admission in ICU and admission in hospital, and that shows that the epidemic is increasing with all these indicators. So the situation is really not very good. And the measures that are taken, what they call maximal alert, just means closing bars and a few restrictions to restaurants. But it's really very minimal procedures. And in the meantime, the epidemic is increasing in other parts of the country which are not in maximum alert. So basically, things are getting worse everywhere, and the actions are very weak, really. So I'm rather pessimistic. I think the epidemic is going to continue to increase, and the hospitals are really going to be hit very hard, and everybody is very tired and overworked, and this is going to be a big problem. What we need is massive testing. What we need is to find the cases, that is not something that we are doing. The cases we are finding are just the tip of the iceberg. There are many more cases. In England, they have done a survey on a national sample of the population to find out how many people were positive. And they have done 5 surveys. The last one was at the end of September and showed that 5.6 per 1,000 persons were positive. If that is the case in France, then we have far many more cases than what we know. So we have a big problem.
Okay, let's find out what the situation is like in Spain, because we're comparing France to its neighbours. Spain, obviously a large neighbouring nation. Let's go to you, Sarah Morris, in Madrid. Just bring us up to speed on what the situation is like in Spain right now and what the scope of the latest measures is to contain the virus there.
Well, Tom, the daily average of cases is about 10,000 on a daily basis this week, but it did peak at about over 11,000 at the end of September, and that really led many governments regionally to take extra measures, particularly in Madrid, where the number of new cases was accounting for about a third of that total figure. Now, the Madrid measures, as you mentioned, have provoked anger because, of course, since the state of alarm ended in Spain, it's up to the 17 autonomous regional governments to actually take steps to run the health systems and to control the rise of COVID-19. And they've introduced a patchwork of measures until last week, when the central government decided that it should step in and it should impose measures on the Madrid region because it felt that the regional government wasn't taking sufficient measures. And now in Madrid, there is a partial lockdown. That means people who live in the capital can't travel inside or outside the capital, and that also affects 8 surrounding towns. And the idea of that is to stop any spreading of the virus to other autonomous regions. But the cases are rising really across the country. In some cases, in Madrid, the regional government insists that it's now falling, but we've seen other areas like Catalonia and Navarre, which has seen a spike in recent days. So all of the autonomous regions have pressure on them to take extra measures, and many of those measures include closing bars early, making sure they have fewer people seated in them, and making sure that there are restrictions on the number of people that can meet together. And Spain for a long time has had compulsory masks even in the street, even if people are in the countryside.
Okay, thanks for that update. I just want to turn to Edouard Salsas, who's been keeping very quiet up until now. You've, of course, got a more of a legal perspective on all of this. I just want to start by asking you a little bit about Spain, because it is a very different point of comparison to France, in the sense that the healthcare system is much more decentralized, and that means that different parts of the country are responding differently. Is that an advantage, do you think, for Spain?
It definitely has an advantage because the healthcare systems are closer to the citizens. So we have the typical example is Germany, which has a very similar level of decentralization than similar to Spain. And the German answer has been very efficient. It's being said that it has been very efficient with respect in comparison to other countries. I believe that the issue we have in Spain, it's very clear and very circumcised. It's the regional government of Madrid. The regional governor of Madrid has a very high responsibility because Madrid is a very dense region, and the impact of the virus has been very high there. During the first wave, we had the virus spread very quickly across the country because Madrid was not. There was no lockdown in Madrid. And what we've seen in the last few weeks is that some measures that were taken in other regions to limit the opening hours in bars, in restaurants, etc., the regional government of Madrid refused to implement these measures. So this linked with the fact that the regional healthcare in Madrid is very poor because it has been dismantled by the right-wing regional government for the past 25 years. It has created a situation where Madrid is a bomb that may explode at some point, and instead of having the courage of taking the necessary measures, maybe if they are not economically efficient, but to order some kind of lockdown, there has been this confrontation with the central government, which has now implemented by force the state of alarm in Madrid. This is something unprecedented in the rest of regions. The rest of regions didn't need the intervention of the central government. They took the responsibility to take the necessary measures. So I believe that the slight difference in the Spanish system is that the decentralized system is good as long as the people in the regional governments are responsible enough to deal with that responsibility.
Okay, well, you've had the last word for the first half. We're going to take a quick break. Come back and join us for the second half in just a moment. Welcome back to part two of the France 24 debates. Now, today we're looking at the COVID-19 situation right across Europe, as the spectre of a second wave of the pandemic looks like it's fast becoming a reality. We're asking, can governments keep their citizens safe without infringing on their liberties? And as new localized lockdowns are unveiled, will the general public play ball? Those are some of the questions we'll be asking. Well, let's examine the situation a bit more closely here in France. The director of the Paris Region Public Health Agency says that COVID-19 patients now occupy more than 42% of intensive care unit beds in the French capital and the suburbs. despite the region being on maximum virus alert. The authorities here say, I quote, "We're racing against time." Let's listen in.
C'est pour ça que j'ai employé l'image, pas pour le plaisir de faire une métaphore maritime, d'une grande marée. Quelque chose qui va doucement.
Elle arrive.
Mais qui arrive et qui est très large. Et comme dans les grandes marées, quelquefois on pense qu'on a le temps. Et en fait, à la fin, il y a une course contre la montre. Et on est à ce moment-là dans lequel on s'engage dans cette course contre la montre.
Okay, so the situation here in Paris, a race against time, according to the authorities. Let me turn to you, Professor Toussaint. We heard this figure, 42% of ICU beds in the French capital and its suburbs are occupied now by COVID-19 patients. Is that figure significant, and does it mean that another lockdown is an inevitability?
Well, you should differentiate what the numbers are in terms of hospital situation and what the COVID progression shows. Those are different numbers. If you look at the number of present beds for ICU, it means that we have 1,500 people in France over a 500 total number of beds. If you look at what was the actual number at the peak of the epidemic in April, it was 7,000. And the number which the instances of the public health authority have said is about 12,000 possible ICU beds that could be open for that. So it means that the rate is very different. The percentage is very different. Now, the second question is that percentage a reflection of what is going on in terms of the entrance and the out patient getting from the ICU, inside the ICU, and the duration of ICU. This has changed a lot again. This is no longer the 6 weeks we have known in April. It is now shorter duration. People are getting back to the conventional hospitalization. The quality of treatment has increased, and the rate of mortality has been reduced by 50% inside. So it means that those different situations no longer show the incrementation again that we have seen in the spring situation.
Okay, so this time around, would it be the right course of action for the French government, if we look at just at the French example, to say to the people, we've got to stay vigilant, but we've got to carry on. Therefore, if everyone wears a mask, and we carry on using these improved techniques for how we cope with COVID-19 patients, we don't need another lockdown?
Well, the lockdown has been a huge restriction for all activities in France, in Europe, and all over the world. I mean, young people have been dying from undernutrition because of the rupture of the lines to bring food in emerging countries. We have seen a lot of new disease, people which couldn't be taken in charge in the hospitals in Europe and in many countries over the world. It means that when we are deciding to stop any activity, we have to understand the long-term effect of the lockdown. Now we have those raging up all over Europe, and I understand how the anger could come in Madrid if we are not confident into the efficiency of the measures and showing, for example, the restaurant or the hall for practicing sport that have been closed when you don't have any cluster, when you don't have an increase of severe cases inside. It makes Zinedine Zidane signing yesterday the Tribune saying maybe the sport could be a very important way to struggle against the disease because you are reinforcing your immune defenses through the physical activity.
Do you want to join in?
Yes, I wanted to join in because the protests in Madrid are not exactly linked to that. The images we were seeing, it's extreme right people with Franco-era flags. So it's more a protest against the public healthcare system. It's the extreme right demonstrating.
No, I am not saying I am approving. You understand what my point is. It's not the question. The question is how we are seeing the economical destruction that we have seen now, the long-term effect in social and economical appointment, and then what we need to see in how we can, what you mentioned, make the balance between the sanitary situation and not destroying the economical one. But many people all over that are not in the right wing are just looking at their work tools to be just outside of their way to improve them, and showing that now they are entering situations that are quite even more difficult, is again the bet that you are doing for the extremists to came back. Remember what happened in the 20s of the last century.
If I may do the link, this same balance is the balance that we need to do with fundamental rights. When deciding for a lockdown, or when deciding for these kind of restrictive measures for the economy or for civil rights, there's also, we need to strike the balance between two different interests. And there has been a lot of debate on whether these measures were attempting against, civil rights. And we've seen in France and in other countries some judicial decisions that have upheld the government decision, and some governments had to, go back to the initial positions because the tribunals decided that they were not allowed to restrict that much the fundamental rights. But indeed, it's a very interesting, the pandemic is giving us a very interesting example on how to strike the balance between two different interests, the individual interest and the common interest.
And a good example for that is what's happening in Quebec. What you've seen in Montreal is that now you could have the police entering the private rooms of the people, the apartments and the houses, by saying you are not following the new rules. And for the civil rights now, it's really a tremendous change that we are assisting.
I'm not sure that a Canadian government, a Canadian tribunal in some months will probably rule that these measures are not exactly
but that's what can do now, just by
constitutional.
having the judge sending the legal way to make the changes if you are given by your neighbors or something like that. It's really a tremendous change of what you can see in terms of very advanced societies as ours, and seeing how much of that debate you are releasing without the true arguments that you need in terms of sanitary goals.
Yeah, we've been using Spain as a case study in this debate, and there are about 720 coronavirus cases per 100,000 people, making Madrid Europe's third densest cluster of infections after Andorra and Brussels. I didn't know that. Andorra, Brussels, and then it's Madrid in terms of the severity of the clusters. Well, as we've been saying, there were big protests in Madrid today against the partial lockdown there. Monday also happens to be National Day in Spain, and of course the celebrations are very muted. And as we were saying just before the break, the far-right Vox Party has seized upon this issue, calling for protests against the state of emergency, also encouraging other demonstrations in Barcelona and Seville. Let's listen to what some of the locals had to say at today's National Day celebrations in Madrid. They're angry.
Pues hoy he venido a manifestarme aquí porque estoy indignada de la gestión que se está haciendo de la pandemia, la gestión no solo de salud, sino también de economía. Y luego, porque yo no soy de Vox, pero es que de alguna manera nos tenemos que quejar de lo que no consideramos que lo estén haciendo bien.
Porque hoy es fiesta nacional de España y no nos dejan salir a la calle, y en Madrid todavía más porque estamos en esta de alarma que no sabemos muy bien con qué criterios se ha decretado.
Nos están engañando porque hay un desgobierno brutal, porque se dedican a tirarse trastos políticamente unos a otros, y lo que están generando es una pobreza en España, tanto económica como de valores, como de principios.
Okay, let's go to Madrid and speak to our correspondent there, Sarah Morris. I mean, Sarah, one of the things we've been talking about here in the studio in Paris is just how perhaps part of the anger there in Spain, and we heard some examples of it in those clips just there, is sort of the lack of buy-in, people questioning, is this actually making a difference? Is it worth me making this huge sacrifice, shuttering my business, not living my normal life, if the result is we'll simply have a second wave, a third wave? Who knows where this is going to go? What would you say is driving the anger?
I think partly, Tom, it's the result of confusion as to why when Spain had one of the most severe lockdowns in Europe, if not the most severe, then the second wave has come about so quickly and has been so brutal. Spaniards weren't allowed out for a walk during their national lockdown, which lasted from mid-March well into the summer, and then there was a de-escalation which depended very much on the region where you lived and how COVID-19 infection rates were declining. But many Spaniards say, well, we've had the most severe lockdown. We've been forced, we wore masks earlier than many other European Union countries, even in the streets, in all public buildings. Why is it that the rate has soared again? And there's a lot of confusion, lots of different answers, and some of it you heard Mr. Sal says they're talking about perhaps underfunding of the health system. There's certainly been queues at a lot of the health centres in Madrid and other parts of the country. But there's also been other potential reasons offered as to whether the regional system, although it devolves power, whether that's caused confusion, whether that has meant that regional governments have been buying equipment separately. There's a group of experts really asking for an investigation into why why there has been a rise in the number of cases. There's been a focus on young people. For instance, nightclubs have been closed in many autonomous regions to stop some of the cluster outbreaks that we've seen across the country. But really, I think there's lockdown fatigue because a lot of people, as you'll remember, lost their jobs back in the last crisis. 1 in 4 people were unemployed, 1 in 2 young people. And many businesses tell me that they haven't been able to reopen because of the lockdown and because of some of the regulations being imposed on them. So it's a tricky balance. And the autonomous region of Madrid said that it had focused lockdowns on the areas with more than 1,000 cases per 100,000 residents, and what they did was stop people from leaving those neighbourhoods. That, of course, was very unpopular because many of those neighbourhoods were very poor neighbourhoods. But the Madrid region said that was a better approach than the current approach by the central government, which is essentially to lock down the whole of the city.
Okay, so a lot of issues you raised there: lockdown fatigue, economic hardship, and of course confusion. We've heard this theme of confusion in a lot of places. When the rules are too complicated, people don't like the rules, they don't follow them. Professor, what are your thoughts listening to what our correspondent said?
Well, I think the major word that was said by Maurice was the word of confusion. And incoherence is another. The fact that having a very coherent strategy on that is very important, and the pedagogy to go to the population to explain, to decide,
get their buy-in,
and then to have them trust what your decision would be, whatever it is. Just having them trust it is the most important. And especially when you are looking, I went by the numbers, today's number by the Ministerio de Sanidad, and looking at the Spanish numbers here, if we may have a look on that, it is showing here that maybe the camera could go.
I'm not sure it can reach that. It might struggle with that screen.
On that,
it might struggle with that screen.
Showing that there is a plateau of the number of cases here that you can see in Spain. So it's no longer increasing as well as in Europe. It is very slowly. And then there is a plateau which has been reached by 2 weeks.
Okay, there we can see. There we can see your graph.
It means here that this plateau and maybe the decrease, the recent decrease, is in complete contradistinction with what is taken as the present measure. It means when you need to have the full confidence of your population, you need to have strong arguments, strong numbers to say that it is a deadly disease which is growing, and it's no longer the case.
And you pick up, you're from Spain, you know the country better than any of us. I mean, do you think there is this element of people just losing trust in the government?
I totally believe that there's this lockdown fatigue and this lack of trust on the government. And what we see in Spain and what we've assisted in Madrid, in the region of Madrid, is a clash between the regional government, which is governed by the right, and the central government, which is the socialists. And since now we don't have the destruction of Catalonia, so the independence issue is now low profile, then there's no other distraction. And now we need to focus on the real problems.
You think it's a pure political
I believe
situation?
that the lack of trust is because what we see is that the decisions or the impression that it gives is that the decisions taken are not motivated by scientific data or arguments, but by political arguments. And playing politics on people's lives, it's a little bit disturbing. And we see that the Spanish political agenda is now pretty heavy. We have the king's issue, we have the judicial power renewal issue, and there's a lot of tension between the left and right. And we see that these two political parties have decided that Madrid and the situation of the virus in Madrid was going to be the battlefield. So I believe that the problem and the issue of the Spanish population is this lack of confidence, because you have the impression that from both sides, the decisions that they take are based on political arguments and not on scientific arguments. I mean, I was looking at your figures and I'm pretty impressed, because when I hear, I'm pretty impressed by your argument, because
That's
when
today's
I hear
number by the Spanish government.
But when I hear the responsible from both political parties, I hear an extreme alarm, and I hear another, the right, the current president of the region of Madrid, who is more or less like our local Trump, saying that everything is fine and that we only need to this will be over in a couple of weeks.
Yeah, I mean, it's a confusing situation for a lot of people because of these piecemeal rules. There are different rules in different places. The rules keep changing. And it's almost like every country in Europe, no one has been spared in terms of the opposition parties seizing on this, criticizing the government.
Except one.
Except which one? Germany? Sweden.
Sweden has made the pedagogy. It has the coherent strategy. It has explained it. And for months, it was struggling against the other countries, and now it has been a death rate less than 1 per day for the beginning of August. Since the beginning of August, there is no more death in Sweden, no more than 1 per day at a mean. So it means that when you end up with that, the opposition just say, well, okay, you choose what you wanted to do, but now you have the result of it. Now the question is, does the council given to Johan Giesecke, who was the head of the public health strategy and who is now counseling and advising the headquarters of the WHO, World Health Organization, does it mean that they had the right way? We don't know. We don't know so far. But it means that they had a very different way to explain that to their people.
Definitely a very interesting other case study for us to look at as a sort of a wild card, how a country has gone down a totally different road. And just looking at the situation right across Europe, I mean, some news just in, 4 members of the Swiss Guard at the Vatican have just tested positive for COVID-19. Of course, that's raised concerns over the health of the 83-year-old pontiff. So it seems like no country is spared, and a high level of risk in many different countries. Let's have a look at the UK, because we've been hearing from the British Prime Minister Boris Johnson in the last few hours. And again, he is facing very heavy scrutiny from the opposition Labour Party. Here's the British Prime Minister Boris Johnson.
The very high alert level will apply where transmission rates are rising most rapidly and where the NHS could soon be under unbearable pressure without further restrictions. In these areas, the government will set a baseline of prohibiting social mixing indoors and in private gardens and, I'm sorry to say, closing pubs and bars. Retail, schools and universities will remain open.
Okay, the British Prime Minister Boris Johnson speaking there. And Edouard, I want to ask you, because, I mean, you've got the legal know-how. You can tell us. I mean, the British government wants to stop people having a party in their own private garden. I mean, many people will be saying there are some serious concerns about the overstretch of the law here.
As we were discussing before, we need to strike a balance between civil rights and the freedoms, individual freedom, and the common interest, and see, the big picture in the country. Of course, it's a little bit, I would say, disturbing to understand that the police can intervene in a garden party. On the other hand, we've seen many other cases, and we do not hesitate to answer yes when limiting, for example, the freedom of expression, or limiting the civil rights for detainees. So in a way, the restrictions in civil rights are always a little bit. It's a touchy issue, depending on the legal culture of each country, of each jurisdiction. These measures might seem more or less shocking. In a way, it's not surprising that in the UK, the intervention in the private space, in the private homes, is very shocking, because the legal culture in the UK is very focused on the individual. In other countries, we will see, and we've seen, decisions from the high jurisdiction, from Supreme Courts or constitutional courts, validating measures that in common law countries have been considered as unconstitutional or not complying with the current law. So, of course, I believe that this balance that we need to strike, it's complicated, and we see how diverse Europe is in this subject.
Okay, we're nearly out of time. Just a very quick word from Madrid, from Sarah Morris. I mean, Sarah, are you hearing words like infringement on personal liberties, overstretch on the part of the governing officials there?
Perhaps not as much as in the UK, but what's certainly true is that the regional governments have introduced, probably there's been a few dozen partial lockdowns, and what has surprised people is that in some cases courts have actually struck down some of those measures, and the governments have had to go to the courts to get their measures signed off every couple of weeks, and have had some checks imposed on those measures. The latest court back and forth was involving the measures imposed by the central government, passed by the regional government. And so it seems as if that by the time the COVID-19 crisis is over, there will be a new body of court rulings that will suggest where the limits lie, at least in Spain.
Okay, well, thank you very much, Sarah Morris. You've had the last word in this France 24 debate. Thank you so much. Thank you as well to Edouard Salsas, attorney in international arbitration, Jean-François Toussaint, professor of physiology at the University of Paris, and also epidemiologist Catherine Hill, who spoke to us a little earlier. That's it from us. Thanks for watching the France 24 debate.